Imagine a machine that breathes for you when you can't. That's what a medical ventilator does. It's a crucial tool in hospitals, especially in intensive care units. Ventilators help patients who have difficulty breathing on their own. This could be due to various reasons like surgery, lung diseases, or serious infections. Think of ventilators as mechanical lungs. They deliver oxygen to the lungs and remove carbon dioxide from the body. This keeps the blood oxygen levels healthy and removes harmful waste. In essence, ventilators provide a lifeline for patients struggling to breathe, offering them a chance to recover. A ventilator connects to a patient through a tube inserted into their windpipe. This tube acts as an airway, allowing the ventilator to push air into the lungs. The ventilator carefully controls the amount of air and the pressure at which it's delivered. This ensures the patient receives the right amount of oxygen without damaging their lungs. Modern ventilators are sophisticated machines with alarms and sensors. These features monitor the patient's breathing and alert healthcare workers to any problems. With continuous monitoring and adjustments, ventilators help patients breathe easier and support their recovery process. A ventilator primarily consists of a pump, a control system, and a set of alarms. The pump is responsible for pushing air mixed with oxygen into the patient's lungs. The control system allows doctors and nurses to adjust the ventilator settings based on the patient's needs. These settings include the breathing rate, the volume of air delivered, and the pressure used. Alarms play a crucial role in ensuring patient safety. They sound off if there's a problem with the ventilator itself, or if the patient's condition changes. This complex interplay of mechanisms enables the ventilator to function effectively as a temporary lung for the patient. Volume control ventilation, or VCV, is a common mode where the ventilator delivers a preset volume of air with each breath. The pressure used to deliver this volume can vary depending on the patient's lung compliance. Think of it like filling a balloon. The ventilator ensures a specific amount of air enters the lungs with each breath, regardless of the pressure required. VCV is often used for patients who have weak respiratory muscles or are deeply sedated. It provides consistent breathing support, ensuring adequate ventilation. This mode is particularly helpful in situations where maintaining a specific lung volume is crucial for the patient's recovery. Section 5. Pressure control ventilation, gentle assistance for the lungs. In pressure control ventilation, or PCV, the ventilator delivers breaths at a predetermined pressure. The volume of air delivered with each breath can vary depending on the patient's lung compliance and airway resistance. Imagine blowing into a straw. The ventilator maintains a constant pressure and the amount of air entering the lungs adjusts accordingly. PCV is often preferred for patients with stiff lungs, like those with acute respiratory distress syndrome, or RDS. It helps prevent lung injury by limiting the pressure applied. This mode provides a gentler approach to mechanical ventilation, minimizing the risk of overinflating the lungs. Section 6. CPAP, constant pressure for steady breathing. Continuous positive airway pressure, or CPAP, provides a constant level of air pressure to the patient's airways, helping keep them open. Unlike VCV and PCV, CPAP doesn't deliver breaths. It just makes breathing easier. Think of it like holding a pillow firmly against a deflating balloon. CPAP provides that constant pressure to prevent the airways from collapsing. CPAP is often used for patients with sleep apnea, a condition where breathing repeatedly stops and starts during sleep. It's also helpful for some patients with heart failure. By maintaining open airways, CPAP improves oxygen levels and reduces the workload on the heart and lungs. Section 7. BiPAP 2. Pressures for easier breathing in and out. Bilevel positive airway pressure, or BiPAP, is similar to CPAP, but it uses two different pressure levels, one for inhalation called IPAP and a lower one for exhalation called EPAP. This difference in pressure makes breathing easier. Imagine having a gentle push during inhalation and a slight resistance during exhalation. BiPAP assists both phases of breathing, making it more comfortable for the patient. BiPAP is often used for patients with chronic obstructive pulmonary disease, or COPD, or those who need more respiratory support than CPAP can provide. By providing different pressures for inhalation and exhalation, BiPAP helps patients breathe more effectively and comfortably. Section 8. Real-life heroes, ventilators in action. Ventilators are essential in various medical situations. They are frequently used during surgery to breathe for patients while they are under anesthesia. In the fight against pneumonia, ventilators provide crucial support to patients struggling to breathe due to severe lung infection. They are also critical in the treatment of conditions like ARDS, where the lungs are severely inflamed and unable to function properly. Ventilators truly act as life-saving devices in these scenarios, giving patients the time and support to heal. Section 9. Conclusion. The vital role of ventilators in modern medicine. Medical ventilators are indispensable tools in modern healthcare. They provide life-saving support to patients facing respiratory distress, bridging the gap between illness and recovery. These sophisticated machines, with their various modes and settings, cater to a wide range of medical needs. From assisting breathing during surgery to supporting patients with chronic lung conditions, ventilators play a crucial role. As technology advances, we can expect even more sophisticated and user-friendly ventilators, further improving patient care and outcomes in the future.